Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey, to let you know that you're not alone. You are in exactly the right place to share stories, learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your aging parents, spouses, family, friends, coworkers to listen to the show. If you have a question or an idea for a future program, share your idea with me by responding to my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. Today, the topic is the challenges caregivers face. If you are a caregiver, you know that the challenges are endless. As I talk about in the video that accompanies this podcast, there is no roadmap or connect the dots for family caregiving unless you do your own investigation and find resources that work for you. Day-to-day responsibilities of caregivers can feel pretty overwhelming, which is why I recommend getting ahead of the curve so that you know what to expect and how to respond. How can you do this? Here is a short list. Number 1, there are over 100 podcasts of this program. Listen to all of them. Number 2, watch all the videos on my YouTube channel that answer questions I receive from family caregivers. Number 3, visit my website. There are plenty of resources at PamelaDWilson.com. A library of articles. There are more articles and podcasts in my Caring for Aging Parents blog. And more importantly, 2 online courses. One course answers questions about guardianship and medical power of attorney. The other course gives step-by-step information about all aspects of taking care of parents at home and, if or when the need arises, hiring in-home caregivers and moving parents to care communities. These online webinar courses are accessible 24/7, so those nights when you can't sleep, you can be productive. You will shortcut your learning curve, especially if you are looking for suggestions on how to have caregiving conversations with parents or siblings, identify signs that parents need more care, learn how to manage medical care, talk to doctors, and more. Today on the topics of the challenges caregivers face, I want to talk specifically about several subjects many of us find difficult to discuss. These include setting boundaries, life support, but probably not the kind you think, and planning for end of life. Stay with me because the conversation about life support may help you look at your caregiving relationships differently. The questions I'm about to ask may have you thinking a little differently about interactions with your aging parents, grandparents, spouses, siblings, or friends. The idea for this program came from a caregiver who was living with and caring for a grandparent. This caregiver, the grandchild, is burned out, not getting a lot of support from parents, which begs the question, why is the grandchild and not his or her parents taking care of grandma or grandpa, right? How did caregiving skip a generation to hop from grandma or grandpa to a grandchild being the caregiver? There could be a lot of reasons. The immediate need in this situation was that grandma or grandpa had a health problem and needed care. Mom and dad are working, so the grandchild, being the most available and flexible, moved in with grandma to become her caregiver. What difficulties do caregivers face in this situation? A grandchild who has no idea of the commitment he or she made when becoming the caregiver for a grandparent. Parents who are relieved that they can go on with their lives and not be consumed with caregiving responsibilities. The problem now is that the grandchild is 19 and wants to get a job, go to school, and be a full-fledged, independent individual. These parents are in denial about the needs of their parent, grandma. They place their child in a situation that solved a short-term problem, but the parents are struggling to deal with today's reality and grandma's future. And the grandchild, the caregiver, doesn't have the life skills to initiate a conversation with parents or grandma about not wanting to be the caregiver, or what happens when grandma needs more care or dies. Not a great situation for this family, right? Let's flip the script. You are the son or daughter caring for an elderly parent. It's retirement time. Or maybe you are 70 and you've been retired for a few years. You stepped into the role of caregiver, but now you want your retirement years back. The problem is that mom or dad have become more reliant on you. If you take a day off here or there, they make you feel guilty for wanting time to yourself. You realize your retirement years are passing by and that you may be in your parents' position with health problems in the not-so-near future, needing care from your children. However, you don't know how to initiate this conversation with your parents because nothing was discussed when you became the caregiver. These two scenarios are a great time to hit the pause button and call a timeout so we can look at the family challenges. How many of you became caregivers with no role definition? If I had to guess, most caregivers would fall into this trap. So, knowing what you know today, what would you do or not do if you could press the reset button and start over? How much time would you commit, and for how long? Having answers to these questions is part of boundary setting and discussing life support. When you think of life support, you might think of the check boxes on that bright green DNR document, which includes questions like, do you want CPR? Yes or no. If you don't know what a DNR form is, it's a form you get from your doctor's office or a hospital, nursing home, or assisted living community that asks what you want for medical care if you become unconscious, stop breathing, and your heart stops. Questions like, do you want CPR or to have your heart shocked back into a rhythm by a defibrillator? Do you want life-extending treatment like intubation or ventilation, which is that machine that breathes for you that we've talked a lot during COVID? Do you want a suction machine to remove mucus from your lungs if you have MS or another disease? Would you consider a feeding tube if you can't swallow? Antibiotics if you have an ongoing infection? Or would you want to be hand-fed by another person if you can't lift a fork to your mouth for health reasons? That include a diagnosis of dementia or Alzheimer's. These are some of the uncomfortable questions that we all must talk about one day or another. What difficulties do caregivers face? These include that gray area in the middle between wanting to be helpful, being too helpful, or taking over because you are an over-controlling caregiver who thinks no one can do as good a job as you. No one cares as much as you do. I know many caregivers who've given up their lives, jobs, careers, put marriages and relationships with their children on the back burner to care for aging parents or grandparents. On the other hand, family caregivers see these actions as being dedicated, dutiful, and responsible. It's not until weeks, months, or years later, when the caregivers are burned out and exhausted, that they dream of regaining control over their lives. I recently spoke to a caregiver in this position who felt guilty about telling her mother that she could no longer be the caregiver. What difficulties do caregivers face? How about placing a value on your life? What about acknowledging the contributions you made or are making today to care for a parent? What about assessing the time and effort you devoted to giving a parent the best quality of life possible for 2, 5, or 10 years? We never think that these actions in themselves that seem selfless are life supporting. Can your parents, grandparents, or a spouse live independently without any of your help? If the answer is no, then you are providing caregiver life support. The challenge is that we never equate caregiving actions to providing life support, but that's precisely what they are. How many children accept the role of assisted living providers to avoid moving parents to a care community? How many children caregivers go bankrupt, struggle financially, or spend their retirement savings to care for parents who did not save money to care for themselves? How many marriages break up? What is the percentage of children who don't do well in school and then become problem students because of a lack of attention or help from mom or dad? These are real life caregiving situations. They happen every day to you or other people. But what if we talked about medical life support and then caregiver life support, with all of the short and long-term effects on day one of caregiving relationships? What difficulties do caregivers face? An inability to predict the future and to realize what happens through the actions of being a caregiver for aging parents or loved ones. The health of aging parents probably isn't going to get better as much as we would like it to. Your parents, children, grandchildren, and pets will all die someday. We are all headed to the end of life. What if instead of avoiding these conversations, we had them as easily as talking about what the weather will be like tomorrow so that we could minimize life's struggles? What if caregiving discussions began with creating a list of what difficulties do caregivers face? Let me give you a list of 2 questions to start with to ask your parents and loved ones. Number 1, mom or dad, what is your plan to take care of yourself when you experience health or mental problems and can't take care of yourself? Hint. Answers like, that's not going to happen to me, or you will take care of me, or I'll think about it when it happens, are not acceptable. Number 2, mom or dad, when you get sick and need care, do you expect me to quit my job, give up my marriage, ignore my children, give up my personal interests and friends, go bankrupt to care for you? If the answer to this is yes, then the third question you ask is, well, how do you see that working out and being good for you and me and my family? These are straightforward and uncomfortable questions that should be asked. Depending on the culture you were born into, your parents may expect you to do everything and give up everything. The next question to ask is, should we expect that level of sacrifice from another person? That level of caregiver life support, so that we don't have to take personal responsibility for ourselves or plan ahead. The reality is that everyone will need help or care to some degree at some point in life. The challenge family caregivers face is the tipping point when not taking personal responsibility on the part of a parent or loved one who needs care turns into a 20, 30, 40 hours a week job or becomes a full-time 24/7 job. What if caregivers simply said no, and as a result, mom or dad passed away sooner rather than later? Is that cruel? Or should aging happen and our own ability to care for ourselves determine how long we live? Have medical advancements and the prescription drug commercials playing on television led you to expect that being personally responsible for your health isn't necessary because a machine, treatment, or medicine will save you? What about aging parents who are stubborn because they won't exercise, eat healthy foods, or take their medications? Why shouldn't they be able to choose not to participate in life or health-sustaining behaviors? Why do caregivers pressure aging parents to act differently? Where is the boundary between allowing parents to live as they choose and stepping in to help but not helping too much? Where is the limit of adult children becoming caregiver life support for parents, resulting in parents living much longer lives but being sicker and possibly miserable, and the caregivers and their families being equally, if not more, despondent because of the damage they are doing to their lives, careers, health, retirement planning, and families? Think about that question and those questions for a minute while we go on a break. Pay it forward to help others dealing with health, aging, or caregiving issues by sharing information about this show and my website, PamelaDWilson.com. The Caring Generation is available worldwide on your favorite podcast and music apps: Apple, Google, iHeartRadio, JioSaavn, Spreaker, Amazon Music, Breaker, Deezer, Listen Notes, Pandora, Player FM, Pocket Cast, Podcast Addict, Podchaser, Stitcher, Spotify, TuneIn, and Verbal. You don't have to go it alone. Caregiving doesn't have to be a do-it-yourself job. Visit my website to schedule a one-to-one telephone or video consultation with me. Click on How I Help, then Family Caregivers, and then Eldercare Consultation. This is Pamela D Wilson, caregiving expert, advocate, and speaker on the Caring Generation. Stay with me. I'll be right back. This is Pamela D Wilson, caregiving expert, author, and speaker on the caring generation. Thank you for being here, following, and communicating with me on social media, Facebook, Twitter, Instagram, LinkedIn, and on my YouTube channel. The questions you ask allow me to create videos and the Caring Generation podcast for you. Visit my website and follow the show on your favorite music or podcast apps to listen to over 100 episodes. Let's continue with our previous thoughts and more questions. Do caregivers go to these great lengths to sacrifice their lives to care for aging parents, spouses, and others out of duty, responsibility, and love, or fear of loss and discomfort about talking about and facing death? Is this the reason that care decisions are delayed? Decisions like when to bring caregivers into the home, or when to consider moving a parent to a care home or a nursing home. Or hesitance to investigate palliative care or hospice care because if this is done, then a parent might die. What difficulties do caregivers face? Difficult family relationships. Why do some siblings run away from providing care for aging parents? Are they trying to avoid facing loss or death? Talking about death is uncomfortable, especially when there is concern about how the survivors will go on. What about spouses who are dependent on the income of another spouse? Do caregivers keep loved ones alive because their income is needed? Household income was a concern by my mother, who said to us, "If your father dies first, I won't be able to pay the bills." At the time, we were too young to understand her concern. This was over 35 years ago. And we certainly didn't say, "Don't worry, Mom, we'll take care of you. We will pay the bills." We were too young and inexperienced. We didn't know what to say. And at the time, we didn't know how to help Mom figure out what to do. Now, my mother died before my father, so this was not an issue she had to face. But unfortunately, this is the reality most caregiving families today find themselves in. You simply don't know what to do, so you avoid the conversation until a catastrophe happens. And it's not just the conversation about death and dying. Caregivers, like a grandchild who is caring for a grandparent, don't know or don't have the life experience or skills to talk to their grandparent or parents about a family caregiving plan. Likewise, the aging adults watching their parents get old don't know how to speak to their children about grandma or grandpa being sick or dying. So many young caregivers feel lost without guidance and they're not sure what to do. Older caregivers going through losses feel similarly. Wouldn't it be better if there was a way to learn what you need to know about caregiving before you hit these rough spots so that you could manage with less difficulty? What do you think? Let's continue with more on what difficulties do caregivers face. Being a caregiver involves a lot of what we want and what we don't want. Things caregivers want might be feeling good about helping another person, learning new skills, improving confidence. Things we don't want are things that we give up or trade to be a caregiver. The time we trade for caregiving and give up friends or socializing. And in many cases, caregivers become lonely and feel isolated. Along with the things we don't want or give up comes the idea of grief. Grieving losses is part of life. This is another painful area to talk about with people who are not caregivers. Caregivers understand the struggles of other caregivers and are empathetic about family conflicts, parents refusing care, difficulty navigating the healthcare system, work-life balance, and many other issues. Grieving is not only related to caregiving. We grieve the loss of friends who move away. We grieve giving up a job to accept another job. Any change in life can be a grieving process. And if we can learn how to manage through this, then grieving and caregiving at least becomes more familiar to us. There's also a lot of judgment in caregiving situations. Siblings judge siblings for being helpful or not helpful. Parents judge their children for not doing more and make them feel guilty. Caregivers judge their parents for being stubborn or refusing care. Caregivers face difficulties because they want to fix things, like fix a parent's bad health, fix that the family doesn't get along, when a better path may be accepting the situation and figuring out what to do about it. So let's think about the end of life. I don't know anyone who says they want to die alone. Dying people want somebody to sit with them, to hang out with, just like isolated, lonely, or depressed caregivers want someone to hang out with. We all want to feel understood, accepted, loved, and not judged. What if we start here to think about not going too far to provide life support in caregiving or any area of life? This includes parents who spoil their children so that these children don't grow up to be independent adults. It includes family caregivers. When we do too much for others, we make people more dependent on us. We put them on our life support. Think about it. Independence is better, yes? While having parents or others rely on you for tasks might feel good, eventually as a caregiver, it's probably going to feel bad. If you're not there yet, you probably will get there someday. Think of a situation at work. Are you always the person people run to if there is a problem? Well, that might initially feel good, unless you begin teaching coworkers and teammates how to do things themselves, to think for themselves. They will always come to you for answers, and then you won't get your work done. You will feel resentful. The habits of caregivers cross family and work relationships. It's better to help others do the things they can do for themselves. Help your parents to do the things that they can do. Don't take away things that they still can do themselves, even though it may take a lot longer. What difficulties do caregivers face? Being too helpful and putting family members on life support. Placing you in a position one day where you become the care receiver and need life support from others because you have neglected your health and your well-being. So if you're in a position that has gone too far, what do you do when you want out of caregiving but you feel guilty? First, find a way to manage guilt by giving yourself credit for all you have done. Make a list. How long have you been a caregiver? What are the things you would have done if you were not spending time in a caregiving role? How have the lives of your loved ones improved since you became a caregiver? What's good about caregiving? What don't you like? How would you like the situation to change? Then, more importantly, what actions must you take to get from where you are to where you want to be? And are you really prepared to make those changes? When you can say, yes, I'm ready, you will need a plan for your parent to get care without you. If you don't know how to do that, contact me. My website is PamelaDWilson.com. You can schedule an online or telephone consultation, and I will help you make that plan. Depending on how advanced your parents' care needs are, creating this plan can take a month or 6 months or longer if you have to apply for public benefits or look for a community. Or if you have to get a job to make money and find someone to come into the home temporarily to care for mom or dad so that you can move out. Millions of caregivers who've given up jobs, income, have placed themselves in a financial rut that is difficult to get out of. They want to leave, but they don't have a job or income because they are living off the income of the care receiver or a spouse or someone else. When that care receiver dies, what happens? If there is no inheritance, you may be homeless and in the same situation. Why not do something about it today rather than waiting to be homeless and having no income? If you've been unemployed for some time, you may need to learn new job skills to get a job. I know this isn't a pleasant conversation. I know many caregivers who've come to this realization, yet they remain stuck for one reason or another, afraid and unable to move forward. Comfort and routine are the enemies of change. Human nature confirms that people in all walks of life have to become so uncomfortable or so miserable before they are willing to take any steps to change a life situation. What difficulties do caregivers face? Hesitance to change, being unwilling to think differently, and participating in ingrained habits that no longer serve you. Change is uncomfortable. It's hard. It's scary. You may have to face many fears and do things you would have never considered, but it's the only path forward to getting yourself out of a dreadful caregiving situation if you want to regain control over your life. You moved out of your parents' home once, or I hope you did. You can push yourself out of your parents' house and life a second time or a third time, although this time it may be more complicated. If you are a spouse caregiver, you may have to bring in-home caregivers if you are financially able, or move a spouse to a care home, or apply for public benefits. The real question to ask yourself is, when will you be willing to stop providing caregiver life support to others in your life and save yourself, your family, your career, your health, your future? That's a question only you can answer. On this topic, there are hundreds of podcasts of the Caring Generation where I talk about how to set boundaries with aging parents, why elderly parents won't make decisions, why being a caregiver sucks, and so many more topics. All these show ideas come from the caregivers that I talk with. If you want to share your story or have a request for a podcast topic, video, or article, visit my website, PamelaDWilson.com, and go to the Contact Me drop-down in the top navigation bar. Then click on Caregiver Survey and complete the information. Thank you all for being here and for the dedication you show to your loved one's care, and more importantly, take care of yourself. Please share the Caring Generation and my website with everyone you know who is interested in proven, reliable tips, information, resources, and research about caregiving, aging, health, and everything in between. Go to PamelaDWilson.com. This is Pamela D. Wilson, caregiving expert, author, advocate, and speaker. I look forward to being with you again soon. God bless you all. Love to everyone. Sleep well tonight. Have a fabulous day tomorrow and a great week until we are here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.